Welcome, my friends, to the Bob and Brad podcast. My name is Mike Keenitz, and today I'm interviewing Rick Olderman, who is a physical therapist. I am asking him questions from our audience that you guys submitted about leg pain issues, including hip, knee, and ankle, and different foot issues. So, without further ado, here's Rick. So, our first question we have is from Facebook. It is from Laura E., and it is the best hip stretches for hip pain, non-arthritic.
Yeah. Well, Laura, I guess my first question would be, how do you know that stretching is going to solve this? So a lot of people imagine that because their hip feels tight, it's a stretching issue. And I'll be happy to share some of those with you. However, it may be a hip tracking issue actually that's causing muscles to be in spasm. And I'll kind of show you what I'm talking about. So, one of the most common problems with the hip is something called an anterior femoral glide syndrome. And what that means is that here's the femur. So, my skeleton here's forward, all right, and here's the femur. The anterior means forward, femoral is the femur, glide means it's sliding, syndrome means there's a cacophony of issues that are surrounded and affected by this and that cause it. So what is happening typically with chronic hip pain is that with anterior femoral glide syndrome, you can imagine that if the thigh bone is migrating forward in the hip socket where it shouldn't be, then it's going to put pressure on the front of the hip. If you have a femoral acetabular impingement, then this will aggravate that. It can cause groin pain. It could cause labral tears. And then other people have pain on the side of their hip, and it's called bursitis, labeled bursitis. But really, bursitis, itis just means inflammation. So really, that doesn't really tell us anything. So why would the bursa be inflamed? Well, because you've got the IT band coming down over the side of the hip. And when it's migrating forward, it's in a position it shouldn't be in, and it rubs that bursa excessively. Because not only is the IT band working on that bursa, but now you've got this sliding movement working on it, and it causes bursitis. Then there are deep muscles in the back of the pelvis that are that attach to this thigh bone that are helping to try to control it. And so the piriformis is the one that gets mentioned the most. Those become irritated in spasm because they're little tiny little pinky muscles trying to hold this big whole system here in place. And that's not really their job. Their job is to be supporting actors. And so these get into spasm, cause piriformis syndrome or other types of issues, sciatic pain, SI joint issues, and so forth. The reason that this is happening, though, is because the butt muscles are not firing. The butt muscles are the big hand muscles. They have many jobs, and they're powerful, and they start from this area of the back, and they move over here and they attach into this thigh bone. And what they do is they create a pivot point for that thigh bone to pivot in the socket. And when the butt muscles aren't firing, then this hip bone starts to migrate forward, and this anterior femoral glide syndrome starts. And then people have all sorts of pain. It's either front, side, back, or global hip pain that's labeled arthritic pain. So really, the cause is an anterior femoral glide syndrome issue. Why is the butt not working? It's usually because of a gait problem. And what's happening with the gait is that typically people are locking their knees when they're standing or walking. That turns off the butt muscles. And so what you want to do is simply stop locking your knees, start softening your knees. And this will help turn the butt muscles on. And so the other exercise I would recommend, I have an exercise in my hip pain program called it's a gluteal pump exercise where you're on your elbows and knees, and then you lift a leg like this to isolate the butt. I find that most butt strengthening exercises are multi-joint, and it's not really isolating the butt because there's so many ways to compensate for that butt not turning on. The quads can help, the hamstrings can help, the back muscles can help. And I find that this butt pump that I have in my home program isolates the gluteals and helps your brain connect to them very well and turns them on well. But no matter how much strengthening you do in the hip butt muscles, if you don't walk correctly, then you'll never use the strength that you're trying to train. Okay, so that's probably almost all hip pain that I see, especially chronic hip pain, has some degree of anterior femoral glide syndrome as the root cause. Okay, but your question was about stretches. So the stretches, mostly you want to target the muscles that are crossing the hip joint. Well, one of those biggies is the thigh muscles in the front of the leg here. I don't like most of the thigh muscle stretches out there because they're not isolating the pelvis and back. And like, for instance, if you stand and grab the back of your heel, your pelvis gets to tilt forward and your back gets to arch. And yes, you might feel a little bit of a thigh stretch, but really what all you're doing is making the pelvis tilt forward and the back arch, and you're not getting as pure of a thigh stretch as you could get. The one that I recommend, and so I'm going to try and pull this up and share it with you. Okay, so this is the one that I recommend most people do. This is a level 1 for people with severely tight thigh muscles and who may have a hard time controlling their spine. You can see this leg that's up and she's holding onto that knee. Pulling that knee back towards the chest is protecting the pelvis and spine. So you get a pure stretch in the thigh. Now, this is level 2. This is what I have most people work up to and do, and usually start off with unless they're in severe pain. So we start with both knees to the chest first, and then you hold on to one knee and keep that knee close to the chest because that's protecting your back and pelvis. And then you lower the other leg down with the knee bent at 90 degrees. And so when you do this, you're stretching across both joints that the thigh muscle is crossing. And this gets into more of a pure stretch. All right. So the knee should be bent at 90 degrees. The thigh should be able to rest on the table here. And this knee, when your thigh muscles are tight, this knee tends to migrate forward because we're all goal oriented and we want to think that our thigh isn't tight. And so we allow this knee to subconsciously move forward, which lets this whole system go down. And you say, oh, well, that's not tight at all. Well, just pull the knee back to your chest and you'll feel the tightness that we're targeting here. And I usually do 30 to 60 seconds per side and twice per side each time I do this. And if you're just starting this, try it once. And if you're sure that it doesn't cause any pain, then I would probably do that twice a day. All right, so the other one would be the hamstrings also cross the hip joint. And so I like doing a unilateral hamstring stretch where, for instance, you sit on your bed and you have one leg up on the bed and the other leg is on the floor. And so this helps you find asymmetries in the tightness of the hamstrings. So that's why I like doing a lot of unilateral stretching, strengthening, and so forth, because it helps us see where our asymmetries are. And if you've got chronic pain, likely there's an asymmetry going on in an area of your body that you're unaware of. And to that end, if there are asymmetries, usually, for instance, if you've got right hip pain, usually that pelvis will then rise higher and the rib cage will will lower down, and it'll create something called a side bending problem. This is what it basically is, and which then can pinch nerve roots and so forth. So solving the side bending problem is easy. All you have to do is solve the reason it's happening is because of some problem down that leg usually. And so once you solve this tracking issue, that will solve the side bending problem too. And once you fix your gait pattern, that's why the side bending problem is happening. All right, so I think we got the quad stretch, we got the hamstring stretch, we have anterior femoral glide syndrome, we've included the side bending problem, and the easy way to test if you've got a side bending problem is just take off your shirt and have someone take a picture of your back. Usually you'll see a bigger crease on the side of the side bending problem. All right, so that'll confirm that that's happening. So let's see. I think that's about all I've got for that one.